Today we're going to discuss something that's important to all of us, our eyesight. So often as we age, we start noticing that, well, not only do we wear glasses, but other things start occurring. Well, today we're going to discuss cataracts and glaucoma. Cataracts occur when the lens of your eye becomes cloudy. Most of us don't even notice this gradual change, which naturally occurs for many people with the aging process. But when that lens slowly but surely becomes cloudy, you start having a dimmer view of the world. And we know that if you have a bright day outside, your view is much better, your perspective is much better. But imagine slowly but surely you're not getting that crisp look at life any longer. You want to take charge so cataracts don't take charge of you. So there are things that can be done. But let's look at what a cataract is. So we have a lens behind the colored part of our eye, the iris, and as a result that becomes cloudy. And it can lead to blindness. Luckily, there's lots of surgical procedures that can be done. But once again, surgery is just that. For undergoing a knife procedure or laser procedure, and you don't necessarily want to do that if you can avoid it because there's always risks associated with surgeries. So it's estimated that roughly 60% of people over the age of 60, so 60% of people over the age of 60 have some level of cataract going on. There's about 1.5 million cataract surgeries per year. What causes cataracts? Well, there's, of course, senile cataracts, which are aging cataracts. There's other unusual cataracts, which we're going to skip over today. We're going to talk about the aging cataracts. Well, excess UV exposure. You go outside, water skiing, hiking, sports, just enjoying the outdoors. You live in a warmer climate. UV rays increase the likelihood of cataracts. So you want to wear glasses, like the glasses I'm wearing, with UV protection. You want to also wear sunglasses with UV protection. That can be one controlling factor. Diabetes accelerates cataracts as well, so you want to control your blood sugars. Also, certain medications like oral steroids, topical steroids, inhaled steroids like for asthma, so prednisone, the inhaled ones, the topical ones, all potentially problematic, accelerating cataracts. So if you're doing those things, I'm not saying stop them, I'm saying take charge by doing things that will help potentially control cataract production in your body. So also research shows that statin drugs like Lipitor, Zocor, Pravachol, Crestor may also contribute to cataracts. Interesting enough, when you're doing statin drugs, you also are lowering your CoQ10 levels in your body. So CoQ10 is critical for your heart's beating every day. So take some CoQ10 if you're doing a statin drug. Unless your doctor has told you to avoid CoQ10, which is a rare exception, unless you're on Coumadin or warfarin, which are blood thinners, taking CoQ10 on a daily basis for all of us, antioxidant, immune stimulant, and can help ward off some of the risks of getting cataracts, let alone heart problems. So what can you do for cataracts? The answer is simple. Antioxidants, so vitamin E, it's a fat-soluble antioxidant. You want to do a mixed vitamin E or a mixed tocopherol if possible. You also want to increase your vitamin A. People with night vision problems often have lower levels of vitamin A. People with skin problems also often have lower vitamin A levels. So consider between 5,000 and 10,000 international units of vitamin A, unless you have liver disease, is a strong consideration because your eye needs a vitamin A. It also needs beta-carotene and mixed carotenoids. So you have a choice of either eating lots of carrots and or because most people don't eat enough fresh fruits and vegetables, increasing your supplementation of beta-carotene, either in a multivitamin or as a separate entity. Also, lutein. You're going to hear more about lutein in a segment that I'm going to be doing on macular degeneration. But lutein is critical for all of us because lutein is a substance which is critical for protecting the eye and the retina, and you want to have more lutein in your diet. They say a minimum of 6 milligrams per day. I personally, clinically, like to see people around 18 to 20 milligrams minimum per day of lutein for my patients. Also, quercetin and bioflavonoids. Quercetin and bioflavonoids are natural substances in foods, can help with allergies, can help with connective tissue, can help with collagen, but it also can help with the integrity of your blood vessels in your eyes and as an antioxidant. Likewise, selenium. It's a trace mineral. It's found in the soil. But like here in the Pacific Northwest where I live, there's no selenium at all hardly in the soil. If it's not in the soil, it's not in the food. If it's not in the food, it's not in me or you. And so we don't have enough selenium. It increases not only chances of prostate problems, cancers of various sorts, but also cataracts. So once again, a good multivitamin can help deliver selenium, and not a cheap one-a-day multivitamin that you're going to find at some large store. You want to find a quality multivitamin because not all vitamins are created equal. And also bilberry. There's a long story many of us have heard about bilberry being used in a war. Which war? Well, World War II. The British bomber pilots used bilberry jam to increase their visual acuity. But bilberry has now been shown to help with cataracts, retinopathies, including diabetic retinopathies and high blood pressure retinopathies, but is also a phenomenal antioxidant. So when it comes to cataracts, you want to consider A, E, the beta-carotenes, the luteins, the quercetins and bioflavonoids, a good multivitamin, selenium, and bilberry. You want to take charge. If you have a family history of cataracts, you've been told, hey, you're borderline cataract, don't accept that. Don't say, well, I'm going to do a surgery, because surgeries also can turn out bad. I'm not saying don't get surgery, but if you can avoid getting to the point where you need surgery, do that, because your eyes are very important. Close your eyes for a second. You don't see anything. You don't want to have that as a potential option for the rest of your life. So take charge and see and devour life as much as you can, because after all, we have eyes and they're intended to work for us, but we have to work for them as well.